welcome. My name is Kimberly, and I'm with the Avalon here in Easton, Maryland. And we're talking again today to Megan Wojtko from Choptank Community Health. She is the Chief Clinical Officer. Thank you, Megan, for talking with us again today. Coming off the weekend, how are things going at Choptank? Any updated news that you can share?
Well, I can say that we are certainly still seeing a lot of patients with symptoms, either virtual or out in their car, and still running probably over 50% positivity with our own kind of PCR testing that we're doing. So staff continue to be impacted, and I would say it's not getting better yet.
Well, today, the topic we do want to discuss today are the testing, actually, but thank you for bringing that up. So let's say you are lucky enough to get your hands on some of these at-home tests. When would you say would be the right time to use them? You're showing symptoms, you were exposed to someone who had symptoms. Can you talk us through what the steps are for actually using one of those at-home tests?
Sure, it's a great question because there's been tons of just information, and it's very easy to get all of this stuff confused. So there are home tests out there, and there should be more available as they kind of work through getting those into more people's hands. And I think to answer that question, you have to know how they work. So the home tests are basically picking up the small viral pieces of the virus that would be in your nose. So a positive result means that it detected enough of those viral pieces. And a negative result means that it didn't. It doesn't mean that, necessarily positive, or that doesn't translate to a negative result, meaning that you don't have COVID or that you won't get COVID. So when you know how it works, then it kind of makes sense that they're going to be the most accurate for those that have symptoms. But there are some other uses that I think that still make them useful.
Okay, so say someone is exposed to someone who's tested positive with COVID yesterday. Would you say that person should test now or wait for 3 days, 4 days, 5 days? They're not showing symptoms. What are your thoughts on that?
Sure. If I was exposed and I wasn't symptomatic, I think that I would first try to get a PCR around day 5, just with how it works. The PCR is going to kind of amplify the smallest little bit. So that's going to be a little bit more accurate without the symptoms. If I couldn't find a PCR, then I would do a rapid. But I would still wait around that day 5 because we know about kind of incubation time from the exposure and then time enough for that viral load to build up. If I test rapid on day 5 and I'm negative, then I know that there's a pretty good chance that I didn't have enough viral pieces in my nose to unknowingly spread it to others. So that is reassuring, but it's not perfect. And so the best thing to do is actually to do another rapid test at least 24 hours later. And then if you get that second negative test, that's even more reassuring. If I knew that I was a really bad exposure and I'm expecting to become positive and I get 2 negative tests in a row, I might even do a third one and 24 hours later if you're able to get them. But you still want to wear that well-fitted mask for the full 10 days.
Let's go to the next question. In a perfect world, when you know that these rapid tests are available, how many do you think you should have at home just to be prepared? I know a lot of people want to know, should I have 2? Should I have 10? Should I have enough for my family? What do you think about that?
Well, I think in my bathroom cabinet, I have 2 boxes, and each of those boxes have 2 kits. We have a family of 4. And I just try to restock them as we can and as we use them. So I think enough to kind of cover the people in the house.
Okay, great. Now, if you test negative, should you feel pretty good about going back to work, even if you were exposed to someone who tested positive?
So if I get a negative rapid result on the days or on the day that my symptoms started, we talked about doing it serially, because that each time you do it and you get that negative result, that's more and more reassuring and more accurate.
Mhm.
And I think it really kind of depends on your personal situation. Because I'm boosted, I would kind of go about my business, but I'm still going to wear that well-fitted mask around others during that, 10-day period, because there's still a chance.
Okay, great. And there are rumors that say you should swab your throat and your nose. Is there any truth to that? Should we be doing that? Or is that just going around and spreading rapidly?
It's a little bit of misinformation.
Okay.
So there is some early data, really small sample size, but some early data that you could get some kind of faster results, because we talked about sometimes earlier in the course with these rapids, we're getting some negatives and then they turn positive later in the course.
Mm-hmm.
So there might be, where you can find it in the throat sooner and miss less. But the problem is that the tests that we have now and the home tests that are out are studied and authorized to use in the nose. So when you use it in a different way than what it was studied and meant to do, then the results don't mean much. And so you have to be really careful, to do anything that is different from what they talk about.
Follow the directions on the paper. Got it. All right. Well, I think we're going to see you again then on Thursday. I think that concludes our interview for today. Thank you so much. In the meantime, everyone watching this, if you have questions regarding any of the topics that we're covering, you can drop us a line at info@choptankcommunityhealth.org, and we will try to get to those questions that you send us. Thank you so much, Megan, for meeting with us today. We hope to have some better news soon with our numbers in the county. Thank you.